right. Well, we are back in the Torrentia podcast studio. We're really excited to have Alicia Mahoney here with BCMS. I'm going to just start out. Alicia, what is BCMS?
BCMS, Business and Clinical Management Services.
All right.
But everybody knows us as BCMS.
Okay. And what do you do?
What do we do? Well, I'll give you a little background. We actually started out, much like you, as a private practice in 1985. And in 2000, my mother, the founder of the company, decided that there really needed to be someone out there who could help practices find that compliance foundation. And I know you and I've joked about compliance. I call myself the fun sponge because we do deal a lot with those infrastructure, putting things in place, making sure that you're not missing anything. And so that's our core bread and butter of what we do.
Earlier this year in January at the Breakthrough event, you and I discussed how many practices are adding cash services such as direct current, harp wave, newbie, laser, shockwave, and they're putting them into their practices. But there's a compliance element about education that really kind of grabbed my attention. Could you talk to me a little bit about that?
Absolutely. It's imperative that when you bring in these services, you have proper education. And we can only do so much of that part. We're going to help you with the infrastructure. We're going to make sure that you've got your OSHA, HIPAA, fraud and abuse. But so often we see clients who take these cash-based services or these, new product lines that are out there, and they don't really know how to properly do it in an ethical way that really adhere to your outcome-based services. And so with us, when you came up and we were talking and I was like, wait, this guy literally does the missing piece that so many of my clients need, it became like, we need to talk now. Let's go.
Yeah. Well, one of the things that really struck me about, compliance, as much as it isn't a fun conversation, it is imperative, it is necessary, it is not optional. And your practice really should incorporate some semblance of a foundation. 1 in 6 providers last year shared with me that they were ready to just completely walk away from the profession, and some of them even worse. There's a little bit of a mental health crisis going on with practice owners. And last year, the statistic that just absolutely blew my mind is internally with Torrentia is about 1 in 6 providers shared with us that they were in a mental health crisis. The talks of suicide were well, above, what I had expected, and I think that really making sure that businesses are built on a solid foundation from not just a compliance standpoint, but an education standpoint, because if we can teach providers how to implement cash services legally and ethically in a way that benefits our patients, the revenue will be there.
Yes.
And I really think that's going to be one of the ways that we can really collaborate on helping providers is not just getting the education, not just becoming, a compliant practice or a bubble buddy shielded, practice. But I think that really helping providers not just sleep well at night, but also increase their revenue, earn more, because PTs are burnt out.
Yes.
They're at a complete and total loss in terms of how they are going about their day to day. The most impressive thing that I see is how excited students are at events like CSM. I was just there last week with Jody, from BCMS.
Yes, absolutely.
And they're ready to go. But by year 5, they look like they just came back from war.
Yeah.
They're disgruntled. They're tired, they're overworked, they're underpaid, the debt is crushing them.
Yes.
And that's part of the reason why, you got to take a tour, today of Remedy Live.
Amazing.
Here in Fort Wayne, where we got to go around and see all that they're doing, having crucial conversations in schools, and really they're helping nationwide, have and engage those conversations. Just about anything, but also about mental health. And, really what we're doing here with Torrentia is supporting that cause. And, providers, we hear you, providers, we know that's where you're at. And I'm just really happy to have BCMS on board with what we're doing with that, and looking forward to seeing how that progresses.
Yeah, just another unbelievable resource out there that's normalizing mental health and that you need it.
Mm-hmm.
Do you know that every single person I talk to, and we talk to a lot of people, every single one say the words, "I need to be able to sleep at night."
Mm-hmm.
And that's something that we really are trying to help provide, because it's just like building a house. You would not have a foundation. But yes, we see very few clients have things actually in place before. One of the truths of our industry is, unfortunately, there's no one in your schooling that says, "Hey, here's Compliance 101." They have it in other industries, but they don't in ours. And so with ours, it's one of those things where they don't know what they don't know.
Mm-hmm.
And so many of them are just like, "I'm small," or "I'm just cash." And they think that nothing applies to them. And then when they start to realize, wait, I'm adding things, my staff is growing, maybe I am on the radar, that's when their anxiety goes up. And then they're like, can I continue doing this?
Yeah, definitely. Well, audits are on the rise. I'm sure profit margins, especially in some of the traditional models, are razor thin. And many owners, they really feel like they're working harder, and they don't really have a lot to show for it.
Yeah.
So cash services, shockwave, laser, even some nutritional counseling where allowed, are really becoming alluring to practice owners to add to their practice because they see 20 and 30% profit margins. So they hurry up and buy a device. They're super excited about it. They go to take it into their practice. And I feel that there are some things that clinicians run into.
Sure.
One of them, they have zero foundation in place. You guys provide the foundation, right? Like with BCMS, it's not just, oh, I did bloodborne pathogen training now that I'm doing dry needling. How many pages do you guys provide practice owners, or can you provide practice owners?
Well, so we actually cover a multitude of topics, okay, or categories, if you will. We cover your business office, so everything from like your intake to like your good faith estimates, things to that extent. Clinical operations, this is going to be things where you're really working through your patient care, grievance policies, things of that. Then we get into the one that applies to everyone no matter what, which is your OSHA. And that's everything from fryer drills to needle stick policies to, really know how you clean your practice. And of course, we cover HIPAA, and then we do also HR as well, and, a handbook and things to that extent. But we really do try. This is where I got very excited when I first met you, is how often you go into places and see the lack thereof. These things.
You mean no compliance manual at all? There's no policy and procedure manual, or my personal favorite, hey, you're adding a new item like ultrasound gel to your clinic. Do you have an MSDS sheet that I can look at to see what you've been using or not using? And what's an MSDS sheet?
Ben, it's crazy. And I got to tell you, I talk to a lot of people where they'll say, "Oh, I have a handbook." And they think that they're completely covered. And the handbook came from ADP. And it has nothing to do with healthcare.
Yep.
Or they're like, you know what? I have compliance because I have an AI tool that helps me with my documentation or, my scribing. And they're missing all of the actual written procedures that really protect you. It's all about protecting your people, and whatnot. So that's really where, compliance, no matter where you get it, is important.
Yeah, I think one of the things that was eye-opening to me when it came to understanding the vitality of compliance was it's the state board's job to protect the public from providers. It is not the state board's job to protect the provider. Your policies, your procedures, your compliance training, those are designed to protect providers.
Yes. OSHA, a lot of people think that that's to protect the patient, and it is not. That is actually protecting your people. And so not to go negative, but the number one way that you have an OSHA audit is from an employee complaint.
Right.
They don't feel safe, and so they complain.
I'm going to bring up some really painful points for practice owners. You have a rip or a tear in a plinth. If you're not addressing that, call Alicia. If you do not have an eye wash station, call Alicia. I think so many of these practices, because, Ray, Bruce, and I, we
Mhm.
teach in so many different places all around the country. And the number one thing that I see is when I walk into a clinic, my eyes immediately go to all the things that need fixed.
Yeah,
And then I have practice owners call me and they say, "Hey, Ben, I've got this issue." And I'm like, "Call an attorney."
I know. And attorneys are so expensive.
They are. So you can do much of what some general
Mhm.
counsel would do in terms of providing the appropriate documents, getting people set and ready. Um, so I just want to shift gears a little bit
Sure.
is as more clinicians grow and scale,
Mhm.
the foundation is critical.
Mhm.
And BCMS provides the infrastructure such that providers are not just Loctite with adding their cash services,
Mhm.
but also prevent them from running into future issues.
Sure.
Meaning, when Medicare does show up
Mhm.
to do a site visit or a site audit, you are there to really say, okay, here's how you walk through that process.
Mhm.
And that's been really cool. Talk to me a little bit. You talk very highly of your mom, right?
I
Miss
do.
Mary. I
Yes.
haven't had the privilege of meeting her in person, but I have heard so much about her. Talk to me a little bit about her legacy.
Man, that is such a fun thing as a daughter to talk about. And I've had the privilege to work with her for almost 15 years now. But she's a specimen.
Hmm.
She started in '85, like I said, as opening up her own practice and wanted to just do compliance, which who does that? And she's
Yep.
really, really, really good at that. And she's been just instrumental in lobbying and being part of
Hmm.
our industry as a whole. She's just a champion of trying to better the industry and was very instrumental in helping with direct access in the early 90s. And so she's been, like I said, a champion from the get-go. Um, she's a legend with a number of our partners as
Yep.
she can hang with the best of them. And I think that I can't wait for you to actually sit down with her, maybe have a bourbon or two with her.
I would love that.
Absolutely.
One of the things that you said that stuck out to me in your
Mhm.
presentation at Breakthrough
Mhm.
was you said, and I quote, growth magnifies what's already there.
Yeah.
And if you don't have systems and processes in place and something happens, that's magnified.
Mhm.
If your staff makes a mistake with a patient, whether that's a needle stick injury,
Mhm.
whether that's a pneumothorax, in light of recent news, those policies and procedures are typically what you fall back on.
Mhm.
And I know you're not here to scare providers. You
I
said that
know.
about 15
I
times the
know.
last time I heard you present, but there is an element of responsibility as a practice owner. If you want to make higher dollar amounts in your clinic, higher dollar amount equals higher
Yeah.
responsibility and also higher risk.
Yes.
So talk to me about how BCMS helps practice owners sleep at night. Like, what are some of the tacticals that you guys use as a company to help practice owners?
Well, I like to give kind of an overview to make compliance more digestible.
Mm-hmm.
And there's really 3 or 4 pillars of risk.
Mm-hmm.
There's payment, so that's if you take insurance or not, because even cash-based services, you need to abide by your state laws and your Practice Act. There is privacy, that's your HIPAA.
Yep.
And then there is your people, that's your OSHA. And then there's your professional liability. That's
Yep.
how you are from an ethical provider. And so, with these 4 real pillars of categories, you can really break down knowing that you need to just have
Mm-hmm.
policies and procedures, education and training, and you need to have reinforcement and monitoring.
Yep.
So many people think, oh, I have a manual that has been sitting in an office for the last 4 years that hasn't been touched, looked at, modified, and has dust on it. Nobody can even see it. And so what's the use of it? It's just paper.
Right.
And so literally this morning was looking at an email from a client who had a needle stick yesterday. And they are a relatively new client. And the first thing we directed them to was their environment health and safety manual to go through their needle stick policy, because there's a true protocol of what to do and how to, document it appropriately and all
Yep.
those things. Because ultimately, again, I'm going to go back to the employee. If the employee felt that how it was handled was not safe or proper, that's when it comes back and bites you. And if you've got
Mhm.
all this in writing, suddenly it's like, I'm okay.
Yep.
Incidents are going to happen. I
Mhm.
think that
They are.
one of the things that you see a lot, and especially with like the stuff that you guys provide with education, is it can be the difference between negligence and an incident by having something in writing.
Yep.
If you don't have proof that you've educated properly and whatnot, literally, you have no way of saying that this was done appropriate.
Yeah. So why does compliance matter so much when you're adding new services, right? Like we hear all the time, I just want to add cash services to increase my margin. Why is compliance so critical for that?
Put you on the radar. Nobody likes to hear those. And I
Mhm.
want to say you can be a small practice and add, different things that are going to put you on the radar. A lot of people don't think about the fact that cash-based services can absolutely be associated with anti-kickback statutes
Mhm.
and remuneration. And
Yep.
so if you're doing these new cash services and you're not doing them correctly, um, people
Mhm.
whistle blow. That's a very big thing that happens with those. And so again, we are totally in favor of every one of our clients adding cash-based services,
Mhm.
anything to that, because we want you to have the profit margin. We want your vitality. We want you to be happy. And we also want to see what is really exciting, and that's seeing the patient care
Right.
really elevate. And
Yep.
so we just want to make sure you're doing it right.
Yep. Well, with the rise of artificial intelligence and the rise of technology, I've really seen my patients, especially in the past 3 years, be much more prepared coming to their visit. Meaning they come to me and say, Ben, I know you use focus shockwave in your clinic. I want focus shockwave,
Mhm.
right? And then there's this element of, okay, the patient wants it. They're clearly educated on it. They're seeking it out. But we then have an ethical duty, right? You and I talked, our education classes tee providers up
Mhm.
for the number of sessions
Mhm.
based on the research for a given condition.
I love
We're
that.
not selling 25 visits just because.
Mhm.
We're selling 25 visits because that's what the literature tells us we should be recommending, which for those anti-kickback statutes
Mhm.
and some of the things we talked on our webinar with your mom, you're making an ethical clinical decision, not a decision based in this is going to make me more money.
It makes my heart so happy to hear you say things like that. I just love hearing that the way your education is designed is from research
Mm-hmm.
and from clinical outcomes. And it makes someone like me, who is always saying, I'm the fun sponge, don't do this, don't do that.
Yep.
It makes me feel very comfortable and confident that there is people like you and Ray out there just really providing unbelievable guidance, education that is sound
Yep.
and ethical and compliant. My word.
Hey, it's Bruce and Ben. We wanted to take a moment to welcome you to our YouTube channel, Torrentia Medical Education.
Torrentia was created for rehabilitation professionals of all kinds to really work together to start changing the way that healthcare is currently being practiced and what the future of healthcare looks like.
We hope that our content and community helps inspire you to be a part of the next level of clinicians that are going to treat our patients out in the world today.
Beyond just joining us in our free community that we call the Torrentia Tribe, you can also check out some of our events on our events page at torrentia.com. Each and every one of our orthobiological hacking conferences and events and future events to come is really designed to help you really master and learn these regenerative concepts, as well as take charge and move the rehabilitation profession forward.
We're really excited about the orthobiological hacker certification, and we have much more content coming. So subscribe, check out our YouTube, check out our website, join the community, and we hope to see you at our events.
And remember, a storm is coming.
Thanks so much for watching.